myasthenia gravis. That's right, the west side is gravis territory. Their insignia, a grave, which you'll see tagged on the electrical end plate. Myasthenia gravis is an autoimmune condition characterized by fluctuating skeletal muscle weakness caused by autoantibodies that target the postsynaptic acetylcholine receptor. So, stay focused on that motor end plate. It's where all the action is. Wait a minute. You hear that? That snapping? It's the leader of the gravis gang, myastheno. Yeah, you better beat it, kid. In myasthenia gravis, the T lymphocytes are crucial for stimulating antibody production by the B cells. IgG autoantibodies, specifically, target the nicotinic acetylcholine receptors of the motor end plate. Of note, in a subset of cases, the autoantibodies target muscle-specific kinase, or MuSK, which is a protein found on the postsynaptic muscle cell membrane. But we'll just keep it simple and focus on those IgG antibodies, depicted here by the IgG keys pointing towards those nicotinic ion channels. When IgGs bind to the nicotinic acetylcholine receptor, they block neurotransmission through two main mechanisms. First, the complement system is activated. At Sketchy, activation of complement is represented by, well, complements, of course. High fives all around. Complement activation leads to the destruction and depletion of receptors. Ultimately, destruction of the acetylcholine receptors makes it harder to generate an action potential to contract the muscle, thereby causing muscle weakness. Second, IgG binding also increases the turnover of the receptors, shortens their lifespan, if you will. Smoking will do that. As with most autoimmune diseases, myasthenia gravis is more common in women. See that pretty girl in the window there? It also has a bimodal onset, with the first peak around age 20, typically affecting women, and a second peak around age 60 that's more common in men.